I'm Juris Hedges, Dean of the John A. Burns School of Medicine. I almost said I'm John A. Burns. He was a little taller. But we do have a governor with us, so it's almost the same. Welcome. This is not only an exciting day because we don't get bills signed here in our lobby every day. In fact, this may be the very first time that has happened, so it's a very exciting time for all of us. It is also our first day of the first year for our class of 2020. So our incoming medical students are with us today. I got to greet them earlier today. And so on their break, they may be kind of lining up, wondering what is going on down here. But one of the things you need to keep in mind is those will be the future doctors who will be writing the medical marijuana prescriptions. They'll be the ones who need to understand what is the best dosage and the best product to use for different conditions. So we have a lot of things we need to learn, and it's very important that as this bill was structured, it gives us the chance to learn and tailor what we're doing for the people of Hawaii. So thank you all who participated in this effort. With us today also from the Cancer Center, Joe Ramos, who's the Interim Associate Director. Dr. Ramos is carrying the load until our incoming director, Randy Holcomb, joins us in October. So we're very pleased to have him with us. And next to him, Bill Richardson. Most of you know the Director of the Office of Technology Transfer and Educational Development at UH Systems. So well represented by UH Health and Technology today. I'm going to turn things over now to the governor, who will share a little bit about those legislators who helped make this happen and is really in support of what we're trying to do to help the people of Hawaii. Governor Ige.
Thank you very much. Aloha. Good morning. Thank you for joining us this morning. It really is an honor and privilege for me to be able to sign House Bill 2707 relating to medical marijuana here this morning. This measure clarifies and amends the law pertaining to the medical marijuana dispensary system. Overall, the bill aims to ensure the efficient and responsible operation of the dispensaries, and it assures access to medical marijuana for patients who qualify. Specifically, the bill does a number of things. It establishes a legislative oversight working group. The bill also allows the University of Hawaii to establish medical marijuana testing and research programs. As the Dean had said, we do believe that that's a very important component as we move forward. Third, it requires the Department of Health and licensed medical marijuana dispensaries to provide data to the Department of Economic Development and Tourism, and amends various definitions and clarifying provisions throughout the measure. Just wanted to thank the legislature for their involvement. Really, this bill does tweak and provide a better platform for medical marijuana moving forward. And finally, the measure also allows advanced practice registered nurses to certify patients for medical marijuana use. Again, I think it's really looking forward and thinking about how we can assure better access as appropriate. And so I did want to invite and introduce Representative Della Al-Baladi, who was very instrumental in organizing this bill signing here at John A. Burns School of Medicine. You know, we have been making an effort to try and get out and do bill signings in those communities that are directly affected by the measure, and we thought it would be most appropriate that we do this bill signing here. So, Representative Baladi.
Aloha, and welcome and thank you to our lovely host, JABSM, for having this beautiful venue for us here today. The goal last year of Act 241 and the goal of today's bill, House Bill 2707, has always been to provide legal access to safe medicine for all of Hawaii's patients. The takeaway message for today, for this bill, for all of you being here is that we really are building the healthcare, business, and government infrastructure for this emerging industry. And the building of this infrastructure is going to take a community. Here today, we have, of course, patients and advocates who have long led the way. So I really want to thank and acknowledge folks like Pamela Lichty at Drug Policy Forum of Hawaii, if she could wave her hands. We have Hawaii Cannabis Care here in the audience. We have Terry Heedy, who has long been an advocate of medical marijuana. So really, it's about patients and our advocates. We have our emerging professional community, and I really want to thank the representatives of the 8 licensed businesses who have assembled teams of doctors, nurses, researchers, biochemists, farmers, manufacturers. We have representatives from from all 8 of those licensees. If you guys could wave your hand, don't be shy, we're out in the light. These are the people who are leading the way. They're going to be helping us advance our industry. We also have industry trade associations like Hawaii Dispensary Alliance, if they could wave their hand, who have been helpful in putting together this legislation. Finally, we have, this is where it's so important, where we're building a community. We may have been slow to this process, 15, 16 years in the making, but we have our government partners here. I want to thank and point out and welcome the Department of Health here with us today. Keith Ridley, Keith, if you could wave your hand. The Department of Health has done an amazing job in a 1.5 year time that we have tasked them with this project. We also have on board JABSOM, and we hope to have on board soon CTAR, UH Hilo School of Pharmacy, UH Cancer Center. Through the working group, we're going to really want to have those conversations to bring these university partners on board. Also, we have with us, and I want to introduce Colin Moore, if he could wave his hand. He's with UH Public Policy Center. He's going to be, and he doesn't realize it, going to really be helping the legislature administratively with our working group. We are going to rely upon them to really help us connect with the community. We have the Department of Agriculture, Department of Business, Economic Development, and Tourism. We have the Department of Transportation come forward to us during the writing of this bill and say, we want to be a part of this because we're concerned about public safety and what it means as cannabis gets used more out there in the community. So we have all of our department members here. And finally, of course, we have law enforcement. Law enforcement is built into the working group, and it's going to take all of us to make this industry really, I think, grow and develop and put Hawaii on the map. We already are on the map for lots of reasons, but I believe that we can put a stake in the ground and be very proud of our medical cannabis industry that is going to be developing from this bill and from the last. So I want to thank the governor for all that he's done, and I know that there's going to be lots of work ahead. So inua.
I wanted to invite Senate Vice President Will Esperanza to say a few words.
Aloha and good morning to all of you. First of all, let me just echo what Representative Belatti said, and thank you for all of the stakeholders and individuals who have been working on this for years. But this is truly a new era in healthcare. And considering that we were the first state to pass legislation in the year 2000, it's been 16 years in working on this and making certain that we get it right. And I do believe we have gotten it right. We can be a model for the rest of the nation. About half of the states have medical marijuana laws today, so there's another half that are going to be looking. And there's no reason why we shouldn't be the leader. And everyone knows that here in Hawaii, we have been the leader in many, many issues. And healthcare and medical marijuana clearly can be one of them. And when you look at the promising research that's already been done, whether it's cancer, epilepsy, cerebral palsy, there's so many Alzheimer's, we can be ground zero and establish and build renowned, reputable world leadership through this Cancer Research Center right next door and through JABSOM here. Hawaii can be the place where medical marijuana grows and becomes a global industry. So thank you to the governor for signing this measure, and again, for all of you participating. The best is truly yet to come. Thank you very much.
Thank you. I'd just like to invite the legislators up and be pledges, and we'll get on with the signing. So House Bill 2707 is now the law of the land as Act 230.